Is it true? Simi told Hector that Dr. Durangian said the hospital was up for sale.
They might turn it into an ortho center with no ER.
Oh, they're always threatening to shut us down, but they never do.
I've worked in hospitals for over 25 years, and they're always threatening to shut down parts of the hospital. Yet for some reason, they never seem to do that. Now, it's being said that this show, The Pitt, is the most realistic medical drama on TV possibly ever. So let's watch some parts of it together, and I'll let you know what I think. How realistic is The Pitt?
Oh, and you got the med students and new interns starting today, so good luck with that.
Lucky me.
Sir, come back here.
No more needles!
Oh.
Sir!
No more needles!
Stop!
They say that in teaching hospitals, July 1st may be the day you want to consider avoiding going to the hospital unless you definitely need to. Now, this is more of a joke than anything because July 1st is the day that new interns and new residents start out in the hospital. So when somebody finishes medical school, they become an intern. That's a first-year resident. They're a new MD or DO, a new doctor. And the first day they start is July 1st. It's also the day that interns who have been working for a full year in the hospital graduate into becoming a second-year resident. And essentially, this is the day that everybody gets advanced up a level and they get more responsibilities, and hence people's fear that maybe they're not up to those responsibilities and they may have a medical error or something like that occur. There have been many studies that have looked at this, and honestly, the July 1st being a more dangerous day in the hospital is probably not really true.
Dr. Rabinovich? Melissa King. I will be joining you today. I just came from 2 months in the VA.
Hey, welcome to Pitt.
I can't tell you how excited I am to be here today, so.
Talk to me at the end of the day.
If you've ever worked in an ER, and I've worked in many ERs, I guess the best way to describe it, it's like working at Denny's. It is feast or famine.
It's diner time.
Now open really late.
There are times where, let's say at Denny's, 2 in the afternoon, it's quiet, you're hanging out, not a lot of customers, same thing in the ER. And then there are times at Denny's, maybe at 2 a.m. on a Saturday night, where you're just getting slammed and there are people coming from the bars and flooding the place, and it is not a fun place to work. That same thing happens in the ER. You never know when you're just gonna get slammed. There's a bunch of car accidents, it's a full moon, you never know. When I worked in the ER, I could be sitting for a half hour playing euchre on the computer, and then a half hour later, I've got 7 patients that I have to be running around trying to take care of, all like that. So it is definitely feast or famine, and that's why ER doctors suffer the highest rates of burnout of all physicians.
Patients, they check in for registration here. A nurse eyeballs them, make sure they're not dying.
And then they come back to...
Waiting room till bed opens up.
For how long?
8 hours if they're lucky.
8 hours is a long time to wait, but not necessarily unheard of in hospitals. Now, she's describing a triage area, and so anybody who comes into the ER usually sees a nurse who's the triage nurse who will determine whether that patient has a high acuity concern, like let's say they've been shot, or maybe they're in the middle of having a heart attack, or they've got a pulmonary embolism. They determine whether it's a patient like that that needs to be seen right away, or whether it's a patient who could wait and be seen when a doctor is available after the more acute illnesses and patients have been treated.
We have some new faces with us this morning, starting with second-year resident Dr. Melissa King, fresh from the VA.
Trinity Santos, intern.
Victoria Giavatti, MS3.
Dennis Whitaker, MS4.
So what is the hierarchy of medical education? Well, once somebody gets into medical school, usually in the first 2 years, MS1 and MS2s, they spend time learning basic science. They learn biology, biochemistry, they learn anatomy and physiology, pharmacology, and all of the basic sciences so that they can get an understanding of how to potentially treat patients. Third-year medical students are in their first year then of actually rounding and working in the hospitals. That is an MS3. Typically, they end up doing required hospital rotations, and these are ones that are in kind of primary care specialties like pediatrics, internal medicine, and they'll also do basic specialties like surgery, OB/GYN, and psychiatry. A fourth-year medical student is in their final year of medical school, and oftentimes a lot of that year is spent doing electives. So for me, thinking I wanted to be a plastic surgeon, I did a couple of electives in plastic surgery. I did one in anesthesiology so that I learned more about being in the OR.
Actually, this is the most important person that you're going to meet today. This is Dana. She's our charge nurse. She is the ringleader of our circus. Do what she says when she says it.
Some people erroneously believe that doctors are the most important people in the hospital, and that is just not true. It's actually the nurses who are the most important people in the hospital. And the charge nurse is the one who's basically in charge of all of the nurses in that floor or that section. Now, there's so many other members of the hospital staff that really don't get the appreciation and the attention that they deserve. Nurse practitioners, physician assistants, surgical techs, pharmacy techs, pharmacists, central processing, janitorial services. There's so many people that are absolutely necessary for making hospitals work and function.
Woman fall from T platforms, good vitals, no head injuries. Degloving injury, right lower leg with open fracture dislocation of the ankle.
Okay, trauma two, let's go. Train ran over her foot.
Got caught between the platform and the incoming train.
Airway and breathing are perfect.
As is circulation, BP 140/85.
So it sounds like this unfortunate person had their leg caught between a subway and the platform, creating what is called a degloving injury. A degloving injury is kind of what it sounds like. It's where the actual skin and tissue is separated from the underlying muscles and the bones. It's a horrifying injury, as you can imagine, and usually necessitates several different types of surgeons to help take care of it. Are you looking for radiant, glowing skin? Look no further than the Youn Beauty 2 Minutes 5 Years Younger Skincare System. Whether you're looking to reduce the appearance of fine lines and wrinkles, brighten your complexion, or simply maintain healthy, youthful-looking skin, my Youn Beauty products are here to help. Do you believe you can look upwards of 5 years younger in just 2 minutes a day? It's true. Check out our online store at younbeauty.com or download the Youn Beauty app on your phone to order yours today.
Students, what might have made her faint on the platform?
Could be an arrhythmia, cardiac event. So she needs EKG and a troponin.
Okay, good.
So Noah Wiley's character is the emergency room attending physician. They're basically the physician that's taken the lead with that medical student, basically helping him out and learning from him. So he's asking the medical student, why do you think she fell off of the platform and into that kind of place between the subway car and the platform? And so she mentioned that maybe a CVA or a TIA, and this is basically a stroke. Maybe she had some type of a heart attack causing her to pass out, or a cardiac arrhythmia. So this is something that you want to find out. Now it's different if you knew that somebody pushed her or something like that, but if she just faints and falls, why did that happen?
We're doing a popliteal block.
Nerve block complete.
Seems like it's starting to work.
Swapping out Jesse.
Takes 10 minutes for the full effect, and the Marcaine lasts a good 4 hours.
She's next for CT.
A popliteal block is when you inject a local anesthetic into the nerves in the back of the leg. And the idea behind this for her is to basically numb up the lower leg so she's not feeling the pain from her big injury. And they used a medication called Marcaine, which is a medication I use all the time. It's kind of like lidocaine. It basically freezes the area so you can't feel it, sometimes for many, many hours, as long as 6 to 8 hours in some cases. Now, interestingly enough, you hear from patients who have large injuries like this that sometimes they don't feel as much pain from it as you may think. As strange as this may sound, sometimes the more painful injuries are the ones that are quite a bit smaller. And I'd say like a paper cut, but you can't really compare a paper cut to getting part of your leg torn off. But paper cuts are really painful.
We need to talk about your numbers.
People we've saved.
Metrics.
Our door to balloon times beat federal standards.
I'm talking about Press-Ganey scores. Patient satisfaction.
If they're still alive, they should be satisfied.
Do you know how likely patients are to recommend this hospital?
This is an emergency department, not a Taco Bell.
Press-Ganey scores are the bane of a lot of physicians' existence. And essentially your Press-Ganey score is how high you score in patient satisfaction. So when patients leave the hospitals will send surveys to these patients and ask them how satisfied they were with the care they received.
I cannot deactivate until you say, you are satisfied with your care.
Well then, I'm satisfied with my care.
There's some hospital systems, a lot of them, that will actually base doctors' pay and their bonuses on what their Press-Ganey scores are. Meaning that for you to get your bonus, you need to have a certain score from your patients. The problem with this is that the goal of being a physician is not necessarily to get a high rating from your patient. There are some patients who want things from physicians and from hospitals that technically they shouldn't get. So if you've got a patient who is a drug seeker, they're addicted to narcotics, and they want you to write a prescription for them for OxyContin, and you say no, they can give you a very low Press-Ganey score. And it's not fair if you get a low score for a patient like that because you are doing the right thing. You are saying, no, this is the right thing for their health. But as a physician, your pay can get docked for that.
To clear the tibia.
Med student down.
It is not uncommon for medical students to faint in the operating room and even in the emergency room.
Miss Rabbit has fainted. Miss Rabbit has fainted again.
Now, I'm very proud of myself that I never fainted as a medical student. I never even came close to fainting, although I know a lot of students who did. The big thing is if you're a medical student and you're going to go into your first operation or you're seeing an invasive procedure, if you start seeing or feeling stars, then you got to go straight to the ground. When people hurt themselves is when they try to stabilize themselves, even when they sit down, they pass out, they fall, and they hit their head. You can get a severe brain injury just from falling like that. And so if you're in a situation, you're starting to see stars, that's the first sign that you might faint. Go straight to the ground, lie on the ground, because that way, number one, lying on the ground, you'll get more blood that goes to your brain and maybe you won't pass out. But even if you do, you're going to be lying on the ground and you're not going to hurt yourself.
23-year-old Ben Kemper, no helmet, got doored riding an e-scooter. Neck versus handlebar, then face planted to the pavement. Obvious facial fractures, but alert and oriented with good vitals.
Now, I mentioned earlier that I've worked in the ERs of hospitals for the last 20-some years. I actually just stopped taking ER call. I did it for free for literally 19 years in my practice. And these are the types of patients that we would see. Patients who are in trauma situations. I saw a lot of dog bites. And as part of our training as plastic surgeons, it's how to put faces back together after they've been injured. So this one is right up my alley.
How we doing, Ben?
One. Back in my throat.
That's probably from the nosebleed. Short, rapid rhino, please.
Tacky at 120, pulse ox borderline at 90.
So why are they cutting his pants? Well, anytime you have a trauma like somebody is in a car accident, or in this situation it's an e-scooter injury, where you don't know where his injuries technically are, then we actually cut all of the clothes off of the patient. It's a lot faster to cut the clothes off of them, and if they have an underlying injury and you're trying to pull their pants off, you can potentially make that injury worse. Now, this is a big reason why your mother told you to always wear clean underwear when you leave the house, because it's possible, hopefully not going to happen, but it's always possible that if you get in a car accident or something like that, we're going to have to cut your pants off and your underwear off, and the people taking care of you in the hospital just might see those skid marks.
Good vitals, A&O, let's have a look. Whoa, ouch. Floating face.
Before 3 fracture.
You don't see that every day. Okay, let's prep for an airway. Double setup just in case.
Now, there are 3 types of Lefort fractures. There's Lefort 1 that basically just involves the upper maxilla, which is this part of the face. There's a Lefort 2 that goes a bit higher, and a Lefort 3 that essentially disconnects the maxilla, the upper jaw, from the rest of the basically skull. Repairing this is a big operation that can take anywhere from 4 hours to 10 hours long, and we use titanium plates to basically plate those bones back into place. These are operations I have done in my training, but thank God I don't see these in my own practice. So overall, the Pitt does look like a pretty realistic medical drama. It's also got some pretty harrowing patient stories, but the patient stories aren't nearly as harrowing as that other medical drama called Monsters Inside Me. I recently reacted to a video where a woman had black mold growing inside her breast implants. Unlike the Pitt, this is a true story that you gotta take a peek at right up here. And remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.